What are the most effective ways to improve healthcare in Indonesia? Okay, guys, welcome to this video on improving healthcare quality in Indonesia. We are using the mathematical model and mathematical method of DEA. Yeah, we will explore the importance of healthcare in Indonesia's development and how can we ensure the effectiveness, also the efficiency for the better outcomes. We will introduce the data envelopment analysis as a tool to achieve this goal. So, how it is? Let's dive in. Okay. First thing first, in this presentation, we will understanding the significance of healthcare in Indonesia and the need to ensure their effectiveness and also the efficiency. Healthcare plays a crucial role in any nation's development, and Indonesia is no exception. As a rapidly growing country, it is essential to enhance the quality of healthcare service to improve the well-being of their citizens. This is where the data envelopment analysis comes in as a good method to understand this. DEA is versatile mathematical technique that allow us to compare the efficiency of different healthcare providers. By evaluating the inputs and the output of these providers, we can identify areas that need improvement and also optimize the allocation of resources to enhance overall performance in the country. DEA also providing us with a means to benchmark the performance of healthcare facilities and also monitor their progress over time. It is time to understand this, okay? So let's just jump into the formula. Don't afraid of this, guys, okay? This is how it helps to evaluate the providers, okay? DEA itself is a technique that measures the relative efficiency of multiple decision-making units, DMUs, that is similar to the inputs to produce the similar outputs, okay? The foundation of DEA itself is lies in Charnas, Cooper, and Roth's model, so we can call the CCR model. This model is represents the principle of linear programming problem for each DMU. We are denoting this as K. In this model, you can see the U and the V, UR and VI, that are the weights that assign to the output R and the input I respectively. YRK and XIK are the observed value of the output R and also the input I for the DMU K. The objective function in here will maximizing the ratio of the weight in outputs to the weight inputs for the DMU K, while the constraint ensuring that the same ratio for all other DMUs is less than or equal to 1, okay? The optimal value of the objective function provides us with the efficiency score of the DMU K, which ranges from 0 to 1. An efficiency of 1 denotes an efficient DMU, while a score less than 1 will indicating inefficiency. Yeah, the AI here has a role as an assessment tool as it incorporating the essential quality indicators that are we have here as we can input the patient satisfaction, mortality rates, readmission rates, and also the infection rates into the analysis, and also the other factor we can inputting it here. By applying this DEA in the healthcare sector, we can get the insight into the efficiency and also the quality of the healthcare provider. So it will enable us to make informed decision and improvement, especially if we are working in the government. Okay, so what are the practical application of this DEA then? Okay, first thing first, we need to understand about the data envelopment analysis on how improving the healthcare. Okay, DEA has successfully applied to assess the efficiency of many healthcare providers in the world in many studies. That is including the public hospital and also the primary health center, which is in Indonesia, we call this puskesmas and clinic. Researchers that have used DEA to evaluate inputs like they can creating the and modeling the input of the medical staff, budget, facilities, and also as well the outputs like they are modeling the outpatient visits, inpatient days, surgeries, and also the deliveries, okay? And then the result of that kind of studies is instrumental in identifying the where the inefficient healthcare providers and so they can create a suggestion strategies to enhance their efficiencies. DEA has been a valuable tool in measuring this kind of case, especially in Indonesia. We haven't so many cases that implement DEA as a modeling to address where the inefficiency is. Okay, so by introducing this, hopefully, people, especially in Indonesia, can have another tool, another alternative, and another insight, so they could be moving towards a data-driven approach in decision making and also allocating their resource. By leveraging the power of DEA or other kind of modeling like this, hopefully Indonesia's healthcare system can have a good improvement and also giving a better service to their citizen. But using this kind of method also have several limits. Okay, what are the limits? First thing first is requirement of the sufficient DMU. Okay, DEA require a sizable number of decision-making units with similar objective and also the activities to ensure the reliable and meaningful comparisons. If there are not enough DMUs available for the analysis, the results, of course, will be biased or even inaccurate. The next thing is we need to understand that we are under assumptions of full control. DEA assuming that all inputs and also the outputs of healthcare providers are entirely controllable by the DMUs themselves. In the real world, this is not the case, okay? There are any external factors such as the demand fluctuation, patient characteristics, regulation, and many others that can impacting the efficiency of healthcare providers and also the modeling. The third thing is in this kind of mathematical model, stakeholder preferences is not considered. DEA doesn't take into the account the preferences or the values of stakeholder when they are assigning weights to input or outputs. Different stakeholders may have varying option on what constitutes crucial factors in healthcare delivery, which could influencing the result. And also, when we are talking about the multiple solution for weighting, DEA doesn't provide a unique solution for optimal weights input or output. So as a result, there would be a variation in efficiency scores, and also it could be biased for the implication and also the improvement strategy. Okay, but despite having those limitations, DEA is still a good modeling tool compared if you aren't using a mathematical model in making a decision. Okay, well, so I think rather than you don't have any model, I think you can use it thoughtfully and also complete it or conjunct it with the other methods, so you can make a good data-driven decision and contributing to the improving healthcare quality in Indonesia when modeling a situation with this kind of model. And I think this is the final conclusion from me. Let's take some key lesson learned in here. Okay, we had summarized some of this, which are DEA is a robust and also objective tools that enable us to evaluate the efficiency of healthcare and also providers, and we can addressing and identify which are the area that could be improved. By comparing the inputs and also the output, we can incorporating quality indicators. We can use this DEA to get a comprehensive analysis of the healthcare services. However, it is also essential to acknowledge the limitation. Policymakers and also the manager should be aware of this limitation that we had mentioned before, and you need to also complement to use this kind of model with the other model and also the information sources to get a more comprehensive understanding of Indonesia healthcare system and also the stakeholders. And with a thoughtful use of application, you can use the model, you can pave the way for a more efficient and effective healthcare landscape in your country. By optimizing the resource allocation and also the decision making, hopefully you can get the ultimate benefit for your people and contributing the better health outcomes for all, because you are using a data-driven decision rather than just using your intuition. Maybe that's all from me. As from the serious research, we hope that this video can provide a valuable insight so you can learn something new, and also we can improving the healthcare in our country. Okay, maybe that's all from me. Thank you. See you in the next video.